Approximately 1.4 million deaths per year worldwide, estimated incidence of 2.82 million new TB cases in 2022, 199 cases per 1 lakh population. Estimated mortality of 3,31,000 deaths in 2022, 23 deaths per 1 lakh population. Approximately 2% of TB patients estimated to be HIV positive.
So, what is TB? Tuberculosis is an infective bacterial disorder which primarily affects the lungs. It can also spread to the other organs like kidney, brain, and spine. TB is an treatable disorder, but if it is kept untreated, then it can be fatal. Not everyone who is infected with TB gets sick. If you are infected but have no symptoms, it's called inactive tuberculosis. TB is dormant, that is inactive in your body. But TB can become active if your immune system becomes weakened. The active TB symptoms include bad cough, chest pain, coughing up blood, fatigue, loss of appetite, weight loss, chills, fever, and night sweats.
The most common type of TB is pulmonary tuberculosis. But sometimes the infection may also spread into the other parts of the body, that is called as the extrapulmonary tuberculosis. You might have also heard about miliary tuberculosis, which has the following effects. Miliary tuberculosis, which can spread throughout your body and causes meningitis and inflammation of the lining of your brain. Pott's disease, also called as the spinal tuberculosis, Addison's disease, an adrenal gland condition, hepatitis, liver inflammation, scrofula, swollen lymph node in your neck. TB can spread when a person with active TB coughs, sneezes, talks, sings, or laughs. Only people with an active lung infection are contagious. You usually have to spend a lot of time in contact with someone who is contagious to catch TB. Most people who breathe in TB bacteria can fight the bacteria and stop it from growing. This causes a latent TB infection. You might be at higher risk of TB exposure if you are a resident or employee in a group of settings where TB can spread, such as jails, skilled nursing facilities, shelters, and other healthcare facilities. Work in mycobacteriology laboratory. Have lived in a region where TB is common, like Latin America, Africa, Asia, Eastern Europe, and Russia. Have been in contact with someone who is known or suspected to have TB disease. Tuberculosis is diagnosed using a combination of laboratory and imaging tests. The most common test is the sputum examination, where mucus from the lungs is checked under a microscope for TB bacteria. Modern molecular tests like CB-NAT, Gene Expert quickly detect TB DNA and also identify the drug resistance within hours. A chest X-ray helps doctors see lung damage caused by TB. For confirmation, a culture test is done. Though it takes weeks, it is considered the gold standard. In some cases, a Montex skin test or blood test is used for detection of the TB infection. Early diagnosis is the key for effective treatment and preventing spread.
I'm going to inform you about vaccination and prevention of the TB. The vaccine for the TB is BCG vaccine, which stands for Bacillus calmette-guerin, which is given in the left upper arm under Universal Immunization Program. What people doesn't know about TB. BCG vaccine does not give 100% protection against TB, but it protects children from miliary TB and TB meningitis. Adults can still get TB even if they are vaccinated, and BCG scar on the shoulder is normal immune response of the vaccine. Now coming to the prevention of the TB at individual prevention, persistent cough for more than 2 weeks, get a sputum test, cover your mouth while coughing and sneezing, and if presence of symptom, wear mask. Household prevention, keep the windows of the house open, keep good ventilation in the room, and for the initial active TB person, keep separate sleeping area. Now coming to TB preventive therapy, people rarely are knowing this. TB preventive therapy, in this medicines are given before developing of the TB. In this medicines are given to children less than 5 years which come in TB contact, HIV patients, and immunocompromised patients.
Let us discuss the treatment for TB. Tuberculosis is not just a lung disease but a public health challenge. The essential strategy for treatment of TB includes combination chemotherapy, which is delivered through WHO's DOTS strategy, that is, directly observed treatment short, which focuses on giving the right drug in right dosage and for right duration and reduces drug resistance. Meanwhile, for drug sensitive TB, in which the positive agent is susceptible to all the first line anti TB drugs. So, all the first line anti TB drugs will be effective as long as they are taken properly and regularly. The therapy is 6 months long, which is divided into two phases. The first initiative phase for 2 months, in which the four powerful medicines are given, as shown, followed by 4 month long continuation phase, in which the dormant bacilli are targeted and relapse is prevented. Drugs are given in weight-based fixed dose combinations with close monitoring for responses and adverse reactions. In TB, the final dose matters as much as the first because incomplete therapy breeds resistance, whereas complete therapy delivers cure. There are various myths regarding TB present in the society, and it's important that we know the reality. So there is the myth that TB is disease of poor people, but in reality, TB can affect anyone regardless of age, lifestyle, or income. Second, there is a myth that TB can affect from food or clothes, but in reality, TB can affect by air when the person sneezes or coughs. There is a myth that TB is not curable disease, but in reality, TB is completely curable with proper treatment. So another myth is the medicine should be stopped when the symptoms are reduced, but in reality, the course of medicine should be completed to prevent the relapse of the disease. So remember, only a proper diagnosis, treatment, and awareness can defeat TB.
The government of India has launched various programs and schemes to control the TB spread and prevention in India. One of which is National TB Elimination Program. Earlier, it was launched as National TB Control Program on 1997, and it was renamed by 2020 with the goal of TB elimination by 2025. The key components of this program was universal access for the TB case studies, free diagnosis and treatment, prevention of drug-resistant TB, patient support and surveillance, and lastly, for the preventive measures which should be taken for the TB elimination. It was based on the TB activities all across the India and is the backbone for the all TB activities in India. The second scheme which is launched is revised National TB Control Program. It was based on DOTS strategy. It was introduced for two main reasons, which is standardized regimes and second is quality assured diagnosis. Later, it was expanded and renamed as National TB Elimination Program, that is NTEP. Programmatic Management of Drug Resistant TB, which is launched for MDR TB and XDR TB. It is used for rapid molecular diagnosis and it is also helps in all oral shorter regimes. Last but not the least, government has also allotted the Nischay portal, which helps in TB surveillance systems, which is based on the patient tracking system, and it also helps in notifying the TB patient and also provide in with the free treatment and diagnostic purposes.
So let's end TB with knowledge and not by fear.